morning. Better late than never. Reggae weekend, you guys. We gonna Bob Marley's #1, and we could give you a medley a little bit before I come on. You remember we talked last week? How you guys doing this morning? I missed you, and I couldn't wait to talk to you this morning. And boy, my watch is going, man. It's saying 9 o'clock and it's 9:10. You like that? It's okay, you know. You don't worry about these little things in life. No, you don't. Some people, I always tell my patients, I say, listen, you think you got a problem? Look at somebody next door. How about the 31-year-old guy who presented to me with cancer of the prostate and it's gone to his bone and he's on his last few days? What will you do? Could you think of a worse problem than that? How about an HIV individual? You've been a virgin all your life and you kept yourself for your husband and got married at 22 and then your husband is playing out a little bit outside and then at 28 you're not feeling well, you're coughing and you're losing weight, you don't know why, and you go to the doctor and he says you've got HIV. You talk about problems now. Today, we started last week about do not resuscitate. And I want to tell you something. We talk about the will. I'm not talking about the estate now. Everybody would like to have their will in place so that when they should leave at the transition or the checkout of this world to the next, everything is in place in reference to, there's no fight. Everything is allotted to whom deserve it. That's the will. For this month, we're talking about a living will, advance directive, a will that is executed while you're alive, but you don't have the ability to say what you want. So what people do, they go to the lawyer and say, listen, if I should die, I'm terminal. I'm talking about cancer patients now, patients who've got cancer. There's no turning back. You've gone to a few doctors, and they all confirm the diagnostic tests and the lab tests, and yes, you have cancer everywhere, and you may have a week, you may have a few days, you may have maybe a couple of weeks to live, and you want to die with dignity. That's what this is about. Do not resuscitate. And all of those things, we'll talk about them. We continue from last week. But, it's reggae week. And listen, this program is not about just music. It's about, even in the music, there's lyrics in there you listen to. So this is educational. These are things that you need to know. And you need to perceive and to ponder on them in your quiet moments. So much things to say today. And let's do a little medley. Yes, Bob. Bob leads way. All the way. And he didn't even sing about, those nice, he's thinking about love too and things. How about turn your lights down low, a little bit of that. Listen, today we have in the studio, we don't pre-record this stuff. We do this thing live, man. I try to walk in the shoes of a guy by the name of Ronnie. I try my best, but can't do it, Ronnie, but we do live anyway, and we get better and better every day. But basically, we're talking about advance directive and the living will. How, if you were terminal, how would you want to die? Would you? I try to be graphic as it can be. I've in its 30 plus years in this medical field, I have seen all forms of transition and dying, and sometimes it's extremely painful, especially cancer patients, because your tissue, whether it's the bone, whichever tissue is invaded by this multiplicity of cells that are producing proteins that are non-productive, the dying of those tissues produce pain because there are nerve endings, and it's it could be excruciating, and seeing yourself with all of that pain, you've lived your life, you gotta go, and leaving like that, and the family, all they see, you remember, is mommy or daddy, or my brother or my sister, begging for relief. Let me go. I don't see that as dignity, and I want to know where your thoughts are. 44-1771, 44-1790, 44-1791. Call us and let me, if you're a terminal patient, cancer, more so, or any terminal, you know that you got a few days to die. You want to call us. I want your call. I want you to talk to the nation. Let's talk to us. Let us know what is it like. Take us there. We have Colin Daniel, certified chartered accountant, one of the top in his field. And Colin is here with us to tell us his views about this living and dying. Colin, do you have a passion for life in itself?
Definitely. I've had one major illness, and fortunately, I didn't have to make a choice about if I had to transition or not. But it's based on my mind in terms of the outcome of that incident. If I did not have the capacity to make a decision, it would have been left to my wife and son to make that decision for me. And then, as you know, my father, the last few years, was very ill. And it's only the last week of his life that he could not communicate. But in that last week, if we had to make a decision, I think at this point in time we will still be agonizing over there. But when it came for his time, it was clear that it was his time. And we did not have to make that decision. But if, say, last July when he was admitted in hospital, and he had to make that decision. In fact, he was asked the question, being prepped for surgery, to resuscitate or not, and he chose yes, to be resuscitated. But the doctors wanted us to make that decision, but at that point in time he felt that he was well enough to make the decision for himself. We discussed it with the doctor, we went in to see him, discussed it with him, and he made the decision yes at that time. I think by November when he passed, if that same question was asked him, he would have said no. So we've had some very personal and recent experience with this.
Well, do you know that it's illegal right now for you to, if you have a document saying, I do not want no heroic measures made to sustain my life. I would like to, if we get to a stage, well, you could give me some medicines to bring my heart rate up or bring it down or give me some oxygen. But I don't want no machine breathing for me or somebody pumping my chest and all those type of things, because I know it's futile. I'll be a vegetable on that machine and then leave in that type of way. I don't want that. But you know, if you have that documentation, which is called Advance Directive or Living Will, the doctors are urged, if your heart stops, to go and start it back, or to get you or perform ACLS. How do you feel about that?
Yeah, the doctor did make it very clear there was no legal recourse for them. They had to do everything that they needed to do to resuscitate him, because there's no particular law in Barbados that allows them to withhold care, or the family to withhold care. All the decision that can be made is to resuscitate or not once the heart stopped. But at the point in time, if you started to fail and they knew that failure was going to be complete, they had to do everything to resuscitate, and they had to do everything regardless of what the expected outcome would have been. So the quality of life was not a consideration. The only consideration was life, but it does not deal with the quality of life at all. And that's more important. As I've gone through, see my father die recently, and my mother passed 10 years ago, my brother-in-law passed 10 years ago of terminal diseases. They had to endure to the final end. My mom was wearing 2 patches morphine per day during the last couple of weeks of her life, just to keep the pain away. And the last 2 or 3 weeks, you would see her holding the medication on her tongue till she can try and get it out when no one was looking. Right? She had made that decision that this was her time. She did not want to go through the pain. She could not communicate. It was too painful for her even to talk. So if she had the ability, I believe, to have made that decision, she would have made that decision herself. Right? Her condition was terminal. It was clear from the time it was caught that there was no turning back. All they can do was chemo. And then after the chemo was completed, they knew that there was a few months after that. So even going through chemotherapy, all that could have done was relieve the pain, slow the disease, but never stop it.
You know, but you see, people think it's only the patient, but also you look at in the scenario around in a hospital situation, you have the nurses, you have the doctors, you have the family. After the patient, it becomes the family. That's the hierarchy. That's how I place them. Patient on the top, family at the bottom, and then we doctors and nurses come on somewhere down the line in the pyramid. And you have a lot of emotions going on. You're looking at your loved one rinsing in pain or rinsing in pain, or whichever way you want to say it. They're really in excruciating pain. Every breath becomes troublesome. How do you feel as a family member?
It was traumatic. I was unfortunately not in the country at the time, but I spoke to my mom every day from the time she was diagnosed. My sisters bore the brunt of it. One of my sisters actually went through with her husband at the same time. They died 2 weeks apart. And so on a family basis, we had to cope with watching two people at the same time pass before our eyes. And that was, you get sadness, you get anger, you get frustration. There's so many emotions. You get those moments of joy when you see them smile, the real smile. I saw my mom smile the last time, the Saturday before she died. And it was a friend of hers, and then a sister she was a bit estranged from came in and visited her that Saturday afternoon, and my mom just glowed. And that was about the last time. I left the Monday, so that was literally the last time I saw my mom really have joy. But I know in a period from the time she was diagnosed with pancreatic cancer, that she made the decision to live her life as passionately as possible. And she did that even as she was going through her chemo, until the time when there was very little more she can do. But 4 weeks before she died, it was the harvest at Sunday at Bethel Church.
Okay.
And I remember Reverend Saunders speaking about her at the funeral, getting out of her bed, coming down to the church, and do what she could to help the church prepare for harvest, and then went back home. So she did the things, she continued to do the things that she was passionate about. But when you saw a very brave spirit which helped you grasp what life really could be about, it is in those moments, as you see your loved ones die, that you really understand how they lived.
You know, when I look at the end point, if I should reflect into myself, I would say, if I want to die, I have terminal illness. Now, please, listeners and tourists and everyone out there in Radio Land, you're listening to me. We're not talking about assisted suicide. We're talking about people whom are terminally ill. They're got their end point and they're gonna die. And if you try to resuscitate them, it's hopeless. Those are the people we're talking about. I see myself in a room with my family around me, playing my music. The doctor gives me medicines to make me relax so I feel comfortable, because I can't be comfortable if I'm having a lot of pain. And my family talking jokes with me, and this is the way we laugh and hold hands and we touch, and the priest come in and I talk to him. I say my prayers. I touch my children. I touch my brothers and my sisters. I tell them I love them. I ask for forgiveness. I forgive them. That's how I see the transition. Now, I think that the laws of this, and lawyers and doctors out there, we would want you to call or to visit the website or send me an email, dr.sparman@thesparmanclinic.com. If you can send that, so we try to form a group so we can get these laws changed so that we all can die in dignity. Since you've had your experience, Colin, how you feel about it? I mean, it happened once, you came close to it. Would you, in other words, you've put things in place for the second event if it should happen, or you plan to live forever?
Given family history, I tend to think I can live forever, but in reality, since Lena's asked me to do a show, I've given a lot more thought to make sure I do that. And I will do that within the next 4 weeks. I have a lot of antecedents in my family as far as cancer is concerned, lifestyle conditions that, typical of black males, workaholic. It makes sense for me to do this, right? It's not a choice that I should leave for any family member to make. When we were living in Canada, we made a decision to be organ donors. If anything happened, my wife's aunt passed in 2008 early. She was diagnosed several years before, and she made a decision not to have treatment. When she died, she had made her will, her body was donated to science. So we do have a lot of history within my wife's family and our family in terms of dealing with terminal illnesses. And some choices have been made in terms of making decisions as far as what they want. A lot of people will write things down in terms of, this is what I want for my funeral and whatnot. But no one takes into consideration between that point where illness occurs and actual death. That can be a long space or it can be a very short space. But most people make a decision, this is what I want for my funeral. I want to have a party, I want to have a wake, I want to have these hymns at my funeral. But they don't think about, what do I want if I can't communicate it for myself?
Right, because remember, a lot of us don't know that I've seen patients over and over again. They've gone to bed and never woke up, and some of them woke up with a stroke and they cannot speak. So that is why advanced directives and all these things in place before.
Right.
You don't have to wait until you're 70 years old, because we may never be 70. I think at early age you should start thinking about these things, all right? Because sometimes you're good today and tomorrow you start to feel bad, dysfunctional in your legs, and next thing you know, you got multiple sclerosis or something. So these are all things we're trying to evoke your thought processes, and we want you to know that this is very serious. We all are living, like I said last week, are we living to die? A little baby coming, all you could look and say, well, goodness, a beautiful life. But she has to leave someday, And some of us leave early, and some leave late. I tell you right now, I'll come back and take a break. We got about 3-4 minutes more in the program. But Buju Banton is not coming up today. And I used to go to listen to Buju all the time. And like, since he's not here, like, I don't want to go down today. But I probably might go, Mother Buju Banton, and I was going to play Taurus, but Taurus I couldn't pick up that. What's the song again, man? She's royal. Anyway, I'll come back, and me and Colin, we're going to close this off in a couple of minutes. Yeah, that's Buju. Doesn't get better. The deep voice, and it comes right out. I tell you what, though, off the set, we were talking to Colin, and very passionate about his experience with some of his very family members. And just before, Miss P, where are you? You should be calling and give your input about this thing. Anyway, Colin, just before we close off, tell us, you've seen one of your family members pass, and you've seen, what is the pain like? How do you feel when you see them going through that pain before the last day or so?
It is the one word: frustration. There is nothing you can do. People talk about praying, being settled with yourself, having faith in God. But at the end of the day, there was just absolute frustration. The morning my father died, which was Independence Day, they called about 8:15. And my sister, when we were leaving the hospital, because she went and saw him the night before, she fed him the night before, she was just absolutely still in shock, because she said he ate well, he was responsive, and it was just the sense I got was just sheer frustration that I did everything I could, and it was not enough. It is really that frustration. You just see everything just decline.
Did you shed tears?
All of us shed tears. All of us shed tears.
Do you know, just listening to you, I was just off the set, but I see tears coming down. I must really take this thing real passionate. I really do.
Right.
Because I even could relate to you and my mommy.
Your mom.
My mom, I sat there as a doctor. I saved so many lives. I can't tell you how many I did. Heart doctor, but she didn't have a heart problem. She had cancer. And I'm sitting there looking at her stomach getting bigger and bigger, and I want to say, I called the surgeons. The surgeon said, listen, doc, she's too sick. She wouldn't get out. And I'm thinking to myself, I did general surgery for 2 years. I could take her there, couldn't take this evil thing out. I sat there, I cried and cried. It's hard. Now, you imagine if mommy was going through pain, a lot of pain. She didn't have that. A lot of pain. I could imagine what it would be like. The breathing started to get labored.
Right. And that's what we saw the last week of my dad's life and the last week of my mom's life. It was, you just watch this chest struggle to come up and recede. It just, living is hard.
Very hard.
Living is hard. And, I saw your mom a few times in those last few months. I remember mischievousness, your mischievous smile. And although she didn't talk a lot at that stage, I have really good memories of her. She was in the bed next to my dad a couple of times. I remember when she passed, how, a couple of weeks after that, how it affected you. And I remember you saying to me, you just needed to be on your own and have peace. And to a large extent, that's all we did afterwards. Just spend a lot of time on our own, just reflecting on the time we had with them. In the last 4 months since my dad passed, and 10 years my mom would pass, I've thought about them a lot more than I ever thought about them in the course of my life.
Colin, would you come back next week? Sure. I have a terminal person coming on next week who want to express their thoughts and let you, the nation, know what is it like at the end stage. Remember, everybody they do not normally check out just like that. Some people got to go through the whole dying process, and I told you about that last week. I'll reiterate that next week. But we love you and care for you. Enjoy this weekend. Be careful when you're driving on the road, huh? Don't drive and text. Take your time and drive. We love you and care for you. Thanks for listening, and I look forward to see you at 9 o'clock next weekend. Ronnie, I want to thank you for accommodating me, and we'll see you guys next week. Bye now.